Thank you, Meredith. 15 minutes till 7 now. It is a kind of cancer mostly seen in women. In fact, just this year, more than 30,000 new cases of thyroid cancer will occur in women. This morning, we're taking action for your health. Our Ashley Glass is live in the newsroom now with information that you may never have thought about on how to catch thyroid cancer early. Good morning, Ashley.
Hi, Dia. Good morning. The chance of being diagnosed with thyroid cancer is now more than twice what it was in 1990. That is according to recent stats put out by the American Cancer Society. Well, a local doctor I spoke to knows why that is and how to protect yourself.
Right in here.
Okay, thank you.
Yvonne Taylor has a special request of her dentist.
Yes, I am going to ask for the guard, the shield, to protect my thyroid.
She's asking for this, an extension of the lead apron used during her dental x-rays.
I had never been given that option before.
So as long as it's blocked, it's protected, you're not going to get any radiation.
Radiation exposure is one known risk factor for thyroid cancer. Yvonne's dentist, Dr. Jake Pedraza, uses the thyroid guard for all x-rays. He says it's recommended by the American Dental Association.
Radiation is cumulative, so you want to do everything you can to decrease any radiation to the patient, even if it's a small amount.
Dr. Tapan Paja at the Moffitt Cancer Center says patients can request a thyroid guard, but says radiation exposure from x-rays is so minimal. He stresses other ways to protect yourself from thyroid cancer, like a self-thyroid exam.
Either one hand with swallowing, or two hands, which I use most of the time, just trying to compare the left and the right half of the thyroid as it rises and falls.
He says feel for a spongy or firm lump, usually dime size, and do it at least once a year. Dr. Paja also suggests asking your doctor for blood tests on the thyroid.
That's something that I would recommend for most women every year or two, just as part of the panel with their other blood work.
All recommendations Yvonne Taylor says she will now consider, as she's already taking this one step to dodge thyroid cancer. And Dr. Paja says because of increased awareness and better technology, doctors are finding more lumps in the thyroid these days. He adds, though, only about 15% of lumps found in the thyroid end up being cancerous. Now, Yvonne Taylor, who you also met in my story, the one asking for the thyroid guard, well, she first got that idea after watching Dr. Oz.
You're going to make sure that your doctor or your dentist has a thyroid guard.
That advice coming from Dr. Oz is now sparking controversy. Doctors and dentists from around the country will be on his show today, disputing the idea of demanding a thyroid guard. Now, remember, the local dentist we spoke to was more insistent on using it than the doctor from Moffitt Cancer Center. Dr. Oz tackles the controversy on his show at 9 a.m. That is right here on your ABC Action News Station. Dia, over to you.
Yeah, it should be.